Good evening, everyone. It's Dr. Charlotte Hodges. I am coming to you guys late tonight. I was wanting to get this to you guys sooner, but you know what they say, better late than never. What I wanted to do is tell you a little bit about Obesity Care Week 2020. Obesity Care Week is an advocacy week to get everybody involved and everybody educated, to advocate for our family, friends, and ourselves, because all of us have someone, and maybe even ourselves, that are dealing with obesity and obesity-related diseases. The Obesity Action Coalition, which is part of ASMBS, has joined with 55 other organizations over 50 different countries across the world to celebrate Obesity Care Week. And every day this week, we're going to be talking about a different topic. And we kicked off yesterday just as a welcome. And if you have any questions or ideas, or if you want a little bit more, you can go to obesitycareweek.org. You can also go to the obesityactioncoalition.org as well. And at the end of this, I believe I have a code. I'll have to look for it. It'll be written in the little note section at the bottom of this vlog, but there is a discount code with Bariatric Advantage, which is also one of the sponsors of Obesity Care Week. So they're really great vitamins and supplements, so check it out. I think it's a 20% off coupon. So what I want to talk a little bit about today was weight bias. And you know, it is something that I, as a health professional, encounter just whenever I'm speaking with my peers, and certainly all of my patients that come in to see me, they have suffered from some form of weight bias. We see patients suffering from weight bias, not just in their relationships with their family, friends, with their peers. Patients will see it in school. It affects them negatively whenever, if you're younger, so if you're a child or if you're an adolescent. We do have studies that are shown that you might be perceived as less intelligent, less confident, not as willing to learn. We also, which is clearly a bias that has absolutely nothing to do with your weight. We also are seeing weight bias whenever people are in their work environment. Your weight can certainly affect your ability to be hired. It can affect your, whenever you're getting fired. And it can even affect not only your wages that you receive, but also your ability to advance within an organization. We have a lot of studies that support this type of bias. And I think finally, most concerning of all, I really see a lot of weight bias brought on by the healthcare community itself. I mean, we should be the ones advocating for our patients. And we have studies that show that when we look at the 20 most common sources of weight bias, you know who it's coming from? It's coming from us. It's coming from the physicians. And that's terrible. The whole purpose of going into medicine is to help our patients. We cannot be part of the problem. We have to be part of the solution. So what are some things that we can do? I think first and foremost, I think celebrating a week like this and just trying to get educated, I think it's very, very easy and a cop-out really just to say that, you know what, somebody is overweight and they just need to take responsibility for that. You know, in reality, you could probably use that for anything that anyone is going through. I mean, would you tell someone that has heart disease, you just need to take personal responsibility for that. You don't need to be treated for your heart disease and you shouldn't get that cardiac bypass. Or, you know what, you have diabetes. You should have done a better job with those genes or with all these different health problems. You brought that on yourself. So why should we take care of any of your any of the problems that come along with having diabetes, whether it's having to go to dialysis or having profound vascular disease? We would never say these things. So why are we saying that to our patients that are struggling with the disease of obesity? You know, that is when education and science is key. Obesity is a disease. Is there some behavioral component? Yes, but you know what? With almost every disease process, guess what? There's a behavioral component. You know what we don't have any control over though? Our genes. And a large portion of the struggles that we have with our weight have to do with our genes. I mean, just tonight I was having dinner with my family. Before everybody left, my mom's had surgery, my brother's had surgery, and my mom, she wants to try to get another 5-10 pounds off. My brother, he had a little bit of weight creep back on, and he's like, I'd like to get some of this weight off. You know, I went to a little calculation called the Mifflin St. Jour. That's a little way that we can kind of guesstimate where somebody's metabolic rate is. I calculated it for my mom. She's 70 years old. You know what her basal metabolic rate is? Right around 1,100 calories a day. So what that means is she maintains her weight at 1,100 calories. If she wants to lose weight, she needs to be far below that, which I would never tell a patient you should only eat 800 calories a day. I just don't think that that's something sustainable. So trying to tell my mom a more realistic goal is stay at around 1,000 calories, knowing that it's going to take a while for the weight to come off. Now, does that sound like my mom is being lazy? That my mom doesn't care about her health? No, she just has a really slow metabolism. I calculated it for my brother. My brother is, how old is he? 47. He's 47, calculated his BMR, and his is right around 1,800. If he wants to lose weight, you know what he needs to do? He needs to drop his calories down to about 1,200. That can be difficult. And what we found whenever I was talking a little bit about his diet is he does some snacking throughout the day. Is that a behavioral thing? Yes. But you know what he doesn't have any control over? His metabolism. A lot of that is genetic. And the other thing that we found is that when you lose a significant amount of weight, that is always going to dramatically slow your metabolism. So I think learning some of these types of things, these are just small examples of ways that you can better educate yourself so that you can have a better, more realistic outlook and a better understanding of what your family and friends are going through whenever they're struggling with their weight. I think also just some simple things that healthcare providers can do is you can speak, you don't have to speak, how should I say this? You don't have to be brutal with your patients. You don't have to try to think if you use comedy and fat shame someone, that's going to get them to do the things that you need them to do. I've always found, you know, you get more bees with honey. I think you should just treat people well. That shouldn't be a really, really hard thing to do. So I really do encourage that my fellow healthcare providers just treat every one of your patients with the dignity and the respect that they deserve, because you want them to treat you with the same respect as well. I think also being aware of your environment and your surroundings, taking care to have even just better equipment within the room just to make it much more comfortable for your patients. Remember, as a physician, we are not here for ourselves. We are here for you. We're here for our patient, and we want every patient to know that they're valued and they're worth it, because you are. And that's what we should be giving to you guys every day. So these are just some little nuggets that I want you guys to take care of and take hold of, because weight bias is a very real thing. It can have a very negative impact on many, many aspects of my patients' lives. And you know, whenever I see my patients lose the weight, it's hard for me to explain to them how much more their lives are going to be enriched, not just from the weight loss themselves. And one of the big things is that a lot of these biases will go away. It's a very real thing. I encourage you guys, go to obesitycareweek.org. If you click on resources and actually go to healthcare resources, health professional resources, they're going to have a list of a lot of different articles. There's actually a brochure that you can read through that really goes more into this in depth. And, you know, just be kind. Be there for each other. We need to be lifting each other up. So that should be the mantra of the day. So I hope that this has been very insightful for you guys. Please, please, please share this with your family and friends, especially if you know someone that's struggling with their weight. And if you yourself are struggling with your weight, know that we are here for you. There's a whole community of people that are here, and we want you to succeed. You guys take care. I'll be talking with you soon, and join me tomorrow for day 2. Well, actually, I guess it's day 3 of Obesity Care Week. Good night.